Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, the Executive Director of Speaking of Women's Health, and I am back in the Sunflower House for a new episode. And on this episode, I am interviewing Dr. Jing Fan to talk about acupuncture. And he is so well educated, such an impressive background. He has an undergraduate degree in surgery of Chinese medicine, and he has a master's degree in clinical medicine from Nanjing University in China. He also completed a fellowship in Chinese medicine and a fellowship in orthopedic surgery from Shanghai Jiaotong University. After all this training, he went to Harvard Medical School in Boston to complete a PhD in translational medicine. And he currently works in the Wellness and Preventive Medicine Department at Cleveland Clinic. Wow, such an impressive background. Welcome to the Speaking of Women's Health podcast, Dr. Fan.
Thanks so much, Dr. Thacker, for that kind introduction. I'm really excited to be here on the Speaking of Women's Health podcast. I'm looking forward to chat with you about acupuncture, how it works, and how it can help people feel their best.
This is such an important topic. In fact, after I got back from one of my sessions with you the other day for my shoulder, and I think we're going to post pictures of my shoulder with all the different acupuncture needles in it, one of our nurse practitioners who's been on this podcast, Kelsey Kennedy, and she said it was fine for me to use her name. I'm not breaking any confidences. She's like, I'm the one who found him. He's the best. I said, well, you didn't tell me that. I just found him too. But now we're going to let all of our listeners from 80 different countries who are listening in, and even if they're not able to come to Cleveland Clinic to see you, I think it's so important for our listeners to understand. Tell us, what is acupuncture?
Okay, thank you so much for inviting me here. So acupuncture is a key part of the traditional Chinese medicine, or we can call it the traditional, maybe Oriental medicine, not only Chinese, but also in Japan, Korea, a lot of the Asian areas. So that has been practiced for thousands of years. So the first book we learned in Chinese medicine, acupuncture, is about 3,000 years ago. So it involved inserting very thin, sterile needles into the specific point on the body. We call this point the acupuncture point or acupoints. So these points are located along the pathways. We call them meridians. So they are believed to carry energy, which we call qi. So it helps the circulation of the energy, circulation, the balancing of the energy. The goal of the acupuncture is to restore the balance of the flow of the qi and help the body heal itself.
So interesting. And it's such a long therapy to be around for thousands of years. And that's the one thing that Kelsey said to me is anything that doesn't work or isn't impressive wouldn't have lasted this long. So tell us, how does acupuncture work, and are there different types of acupuncture?
Yes. So yes, we have the two we can call it the concept of acupuncture. One is a traditional acupuncture, one is the modern acupuncture. Because we have been practicing, the Asian peoples has been practicing acupuncture for thousands of years. So the idea, philosophy they're using is qi, right? So the energy, they want to move the energy, they want to promote energy flow. But today, more and more research we found the acupuncture works by stimulating the point on the body and help the balance with a lot of the scientific research of the pathways. So the first mechanism of the acupuncture is the local effects. So when we insert needle in the place of the area, so it triggers some response we call the reflex. The response in the surrounding tissue. So this increases the blood flow and release some natural chemicals like the endorphins, so which reduce the pain and promote healing. Yes, a lot of the application of acupuncture, like for the musculoskeletal pain, was using these effects. So this we call the local effects. It can remove the inflammation and reduce the muscle tension. The second pathway, second mechanism is also another reflex, but we call the somato or the somato autonomic reflex. So this is the reflex, the acupuncture tap into the body's autonomic nervous system, which controls the function like we have internal organ like the digestion, the heart rate, and blood pressure. So there are a little bit complicated, sorry. So there are two pathways, one segmental, one is a brain level. Segmental happens within the single spinal segment. For example, if we put acupuncture needles on the abdominal area, so it may improve the stomach function by calming the nerves connected to that specific spinal segment. That is the segmental pathway. Another one is a brain level pathway. Brain level pathway is the signals travels to the brain first and then influence the body. So, for example, stimulating points on the arms, on the legs, we call the meridians. We put the needle on the stomach meridian, large intestine meridian, the stomach, large intestine, not on the trunk, but the meridian on the arms and the legs. So that can improve the digestion and the cardiovascular function through the reflex involving the brain and the nerves like the vagus nerve. So this is the reflex. And also we can see some systemic effects. We call this is neurotransmitters in the brain. So acupuncture, we can see a lot of the example. Acupuncture help regulate the brain chemicals like the serotonin and the dopamine. Yeah, which play a role, very important role. Today we can use acupuncture help the mood issue. So disorder of the mood and also pain control and even addiction. So this is,
It is so fascinating. So it sounds like it's incredibly holistic. It deals with the whole body, the musculoskeletal system, the brain, the neural pathways, the natural opiate system in the body, as well as the neurotransmitters. So no wonder it treats so many things. At first, when I heard about it being used for so many different things, I thought, oh, this just is too good to be true. Because like I tell my listeners, anything too good to be true usually is. But apparently we have an exception here with acupuncture. So tell us about how you use acupuncture to help people quit smoking and addictions. That's something that plagues a lot of people.
Yes. So yes, because we just mentioned the effect, the mechanism of the quit smoke and addiction is we call the systemic effects. So I remember when I was teaching in Texas, Austin, Texas, we have a clinic help people quit the smoking and help people quit the addiction for the drug use. Yeah. So usually we combine the body acupuncture. That is, we put a needle on the arms and legs, sometimes the scalp, the top of the head, and also we combine this needle with the ear needle, auricular needle. Yeah, because why auricular? Because this area, the ear auricular area, that is the areas the vagus nerve innervate. So yes, when we stimulate this area, we can stimulate the vagus nerve. That is played an important role to help the people to quit the addiction and quit smoking. Yeah, so this is very popular use. We have also an organization we call the NADA, N-A-D-A. NADA is an organization founded and based in the New York City, and this is a worldwide global organization to help people quit addiction.
That's excellent. Does it help with food addictions? Because, of course, obesity is something that, at least in America, we deal with on such a widespread basis.
Oh, yes. This is another application of the acupuncture. So it's not just the in America, but also all the world, worldwide issue. In China, we have a lot of the overweighted people also. So yeah,
Oh,
so
really?
I know maybe you're not familiar how popular acupuncture in China. We have the night clinic, not clinic or the evening clinic. We can call it night clinic because we open until the 9 to 10 p.m. The day. Yeah.
Wow.
So this clinic especially for people for the weight loss. Yeah, weight control. So when they finish their whole day's work, they went to the hospital, the clinic. They can help with their manage their body weight. So for this type of the treatment, we combine the abdominal treatment, abdominal needle with the extremity needles, the needles on the arms and legs. Abdominal needle usually we combine with the electrical stimulation. Electrical acupuncture or electrical stimulation involves a gentle electric current passed between the needles to enhance the stimulation. That is very effective for the weight loss because a lot of people report after the needling, so they feel the needle help reduce the cravings and also improve the digestion and support the metabolism. So it's not like medication or drugs for the weight loss. It has a lot of side effects. But acupuncture, they didn't feel any side effect, but they feel, yeah, so they can constantly feel the improvement of their weight management.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
That is fascinating. And I think when people who've never had acupuncture hear about needles or hear about electrical stimulation, it sounds scary. But I can tell you personally, I had acupuncture years ago for tennis elbow. I went from playing tennis once a week to twice a week, and I have bad tendons, as my listeners know, and I didn't want a steroid injection. And one of our gynecologists on staff was also trained in acupuncture. And she's like, oh, come on, let's do it. I just had the plain needles. It wasn't painful. And I was so improved and happy that I didn't have to take medications or get a steroid injection. And then fast forward several years later, I decided to lift a lot more weights and increase it too much and strain my old tendons. And came to see you, and you also have applied the electrical stimulation. And it's an interesting feeling. It's not painful at all. And afterwards, it almost feels like you've either worked out your muscles, or I felt very relaxed, almost like I had had a massage in a kind of a different way. Is that the neurochemicals in the brain, or?
Yeah. So yes, I just mentioned many pathways. So yeah, so. For the pain issue, it's more than the pathway I mentioned. Also has another, like the fascial network. Yeah, so that is the newer idea that explains how acupuncture can help the connected tissues. It works on the connected tissue. The fascia, we know we are a lot of the whole body full of all of the fascia. Fascia is a network of the tissue running through the body. Yeah, it may act as the pathway for the effective acupuncture also. Stimulating the points might improve how the body communicates, heals itself with the fascia system. Yeah, so that is why acupuncture works very well for the pain issue. We all know the Ohio Medicaid covered acupuncture with 7, let me see, 1, 2, 3, 4, 5, 6, 7, I remember 7 conditions, like the acute post-operative pain, cervical pain, low back pain, migraines, osteoarthritis of the hip and knee, And also one more very interesting, nausea or vomiting related to the pregnancy and the chemotherapy. So all of this is covered by the Ohio Medicaid.
Oh my, I wish I would have known about it. I had terrible nausea with my pregnancies. In fact, it was so terrible. I can't believe I got pregnant as many times as I did because it was terrible to feel nauseated all the time. And so it's safe in pregnancy then.
Yes. Because for the pregnancy, we know some point is not good to use. Some point is good to use. So because for the pregnancy, we know a lot of people concerned about taking medication because maybe not good for the baby. So but the acupuncture is very safe. There's no side effect like the drug, but we can help with the reflex, can help to sedate the nausea and the vomiting. So usually we put the needle on the upper stomach, not lower, but upper stomach. And also, the needle on the wrist area. And also we can add one point on the knee area. So that we just put maybe 3 needles or sometimes 4 needles. We can help the nausea a lot.
Wow. I'm going to have our executive producer and our social media manager, Lee Kleckar, update lots of our pages, like from migraine headache to low back pain to we have a lot of information about nausea in pregnancy. I used a little bit of B6 and then those acupressure bands, but it probably would have been a lot better just to come in and get the needle. Does it stimulate faster digestion? Because what I thought why I was so nauseated is like my stomach just never emptied. The food would just sit there for hours.
Yes. So for all the digestion issue, not only stomach issue, but also bowel movement issue, acupuncture works very well for that. Acupuncture can work for either the constipation or diarrhea. So that is very, very interesting. So some people has diarrhea, we can fix it. Some people has constipation, also can fix it. And sometimes these two type of treatment are similar. That means the acupuncture, the acupoint treatment, the needling stimulating the point, can have the bi-direction effect on the whole body. That is we call restore the balance.
Fascinating. And is this something for children? Is there any kind of an age limit in terms of, is it for cooperation or just development of the nervous system?
It depends. Depends on how sensitive the children or how the kind of education we educate our children about acupuncture. In China, for the kids, acupuncture for the children is a very popular use. So usually 5 years, 6 years children, we can use acupuncture also. And also I did acupuncture for my daughter when they're maybe 3 years old. It's okay for them. They just scared. They cry. But when I put a needle, they feel, it's okay. It's not hurting. This is kind of education. But usually because I'm not a pediatric acupuncturist, usually I work for the patient 8 years above or 9 years above, because I think they can control their emotion and control their behavior better. So I'm so when I see the baby cry, my heart breaks. So I have to admit I'm not a good pediatric acupuncturist.
It's definitely a different skill. I know when I rotated in medical school with pediatrics, I was like, this is not for me. I just want to deal with adults. So it is a different skill set, and just like in so many fields of medicine. But you have been listening to the Speaking of Women's Health podcast, and I'm your host, Dr. Holly Thacker. And I am interviewing Dr. Jing Fan, who is trained in orthopedic surgery, acupuncture, and also translational medicine, and he's done extensive research. So he really understands all the whole biology, physiology, pathology, anatomy, and has studied several different aspects of medicine. And we're talking about how acupuncture works. It works for lots of pain conditions, including chronic lower back pain. We have a podcast on sciatica. Migraine headaches certainly are a big problem. Half the population has them. I had a podcast on migraine headaches, but I didn't include anything about acupuncture. Now I feel like I'm deficient. And some other women's health topics you were telling me, menstrual cramps. I mean, we deal with painful menstrual periods all the time in our Center for Specialized Women's Health, and a lot of times use medication or hormonal manipulation. But you've got a needle to treat that, right?
Yes. Yeah. So the acupuncture, because acupuncture works with the nervous system, works with the endocrine system, and also works with, sometimes works that we can see the evidence to see acupuncture can help the immune system. And so that this is all of this mechanism. So combined, we can see acupuncture works very well for the menstrual cycle regulation. And also sometimes the menopause and hot flashes is not only the pain, but also the help this restore the cycle, the regular cycle, and also the infertility. So the mechanism is we call the neuroendocrine effect. Yeah, neuroendocrine effect regulates the hormones, not like the estrogen, progesterone, but it's works more from the hypothalamus and the pituitary. So the glands, we see the central nervous system. We know there's axle between the central nerve and the target organ, the glands. Acupuncture can regulate the stimulating hormone. Yeah, so and then can help the feedback, the hormone feedback. So I see a lot of my patient who has the menstrual cycle issue is because they're using some fake hormone. Yeah, so they are using the birth control pill. Yeah, improve their sensitivity of the feedback and regulate and promote our natural hormone production, and that can help that.
Excellent. Now, when I asked you before, are there some conditions that we should know that people should get immediate treatment for acupuncture? You mentioned Bell's palsy. So tell us what Bell's palsy is and why it's important for someone to get acupuncture if they develop this facial paralysis.
Yeah, acupuncture helps restore the muscle function and also nerve activity in the face. So we know the local effect improve the blood flow and help repair the damaged facial nerve. If the blood flow improved, all the damaged tissue improved. So that is the one. And also the fascial network supports the muscle recovery also. And the acupuncture not only help the function of the muscle and nerve, but also can have some systemic effect, reduce the stress, also can help the healing. Usually, in China, the Bell's palsy is the main condition acupuncture cover. This is the main condition. Everybody know who has the Bell's palsy, they should go to acupuncture first. So within the first week.
I'm embarrassed to say I didn't know that until you educated me. So, and I would think that people would, if their regular allopathic physician doesn't tell them about that, they wouldn't know. And so you say that they might have the paralysis for several months longer than they might otherwise have.
Yeah. So today, a lot of people assume the Bell's palsy can be healed by itself without any treatment. But in my experience, I see maybe 80% is good, but the some, maybe 10 or 20% is not good. The prognosis is not good. With acupuncture, we can reduce the risk for the long term, the problem of the Bell's palsy. So my experience, the fastest recovery is just 2 weeks. 2 weeks. So everything is good. Everything is recovered. And some people maybe need 4 weeks, the treatment. Usually, I think the median, the recovery time is about 3 to 4 weeks with acupuncture, fully recovered without any problem. Yeah, so that is what I see in acupuncture. And the same for the stroke. Stroke is worse. It's much more severe than the Bell's palsy, because Bell's palsy is a peripheral nerve problem. But the
Yes.
stroke is a central nerve. It's a brain problem, central nerve problem. So the recovery period for the stroke is much longer than the Bell's palsy. But so stroke is another condition in China. Everybody know acupuncture can help. So when they got stroke, they always go to the acupuncture doctors to treat for the treatment for the stroke. We can see with acupuncture, without acupuncture, we can see significant difference between these two groups.
Wow, that is something, because stroke can be so devastating, and any type of paralysis, whether it's peripheral nerve like Bell's palsy or central nervous system. Now, I'm curious about the osteoarthritis indications, because when I look at x-rays of joints, hips, knees, hands, and you see bone on bone, you would think it's end stage. So is it just pain relief? Or, I mean, as far as I know, we can't regenerate cartilage, which loss of cartilage and the joint imbalance is a major part of the problem.
This is a very good question. This is also, I can see a lot of the misunderstanding of the osteoarthritis and how osteoarthritis impact our body and how to fix it. Because we all know, I think everybody learned from the Dr. Osteoarthritis with the x-rays, with the MRI, we can see the cartilage damage, we can see the bone on bone. So that is the main manifestation or phenomenon of the osteoarthritis. But the cause of osteoarthritis is more than that. Why the cartilage damage, why we can see the bone on bone? That is something we need to fix first, right? So we are born with healthy, everybody born with healthy. But why we developed osteoarthritis? That is because of the imbalance of soft tissue. We can see most of people who has osteoarthritis with the deformity of the alignment of the knee. Some people have varus or valgus, we call the knee bending inside or bending outside. That is we call the deformities of the joint. Why it happened? Because the joint, the capsule and the ligament around joint lose the balance. One side is tighter than another side. That is why the body's weight loading more on inside or outside more than another side. That is caused the compartment, the damage, the cartilage damage usually in one compartment. We seldom see both of the because for the knee, for example, for the knee osteoarthritis, we have the two compartments. One is the medial, one is the lateral. Most of the osteoarthritis happened in the medial side. Why medial side? Because the ligament is more likely develop the tighten and shorten than the outer side. The medial side is more stable and more thickness than the outer side. So that is why because I did a lot of the knee replacement in China when I was working in the hospital in China, we found that when we replace the knee, the knee replacement, the surgery, we found that sometimes we just replace the medial side only. It also works. It also works. We don't have to replace the whole knee. Yeah. But the key point is we need to, after surgery or during the surgery, we need to restore the tissue balance, soft tissue balance, the ligament balance. That is the more important than to replace the bone of the knee. Yeah. So acupuncture works. Acupuncture is very fine needle, we know. It doesn't change the structure of the knee, but it can help not only the pain. Pain is absolutely, acupuncture help the pain. Yeah, with a lot of reflex that changed our pain sensation and also the blood circulation. But acupuncture, usually my strategy of to treat the knee pain or all type of the pain issue, I wanted to do the needling on the specific point to restore the balance of soft tissue. That means to release the tightened side and reinforce the loose side. So that is the way I treat the pain issue, especially for the osteoarthritis.
So it sounds like it's very complementary. You could do it in place of something more invasive. On the other hand, if someone does undergo back surgery or knee surgery or hip surgery, they still obviously need rehab and physical therapy and pain control and realignment, which it sounds like, acupuncture helps in those realms. So that is so fascinating. Are there other health conditions that acupuncture can help with, like cancer? Is there any contraindications that you can't do acupuncture in certain patients?
Yes. So cancer is very wide application acupuncture can help. So cancer and also the treatment of the cancer, because we all know chemotherapy has a lot of side effects, like the neuropathy, like the digestion issue, and also some other immunity problem. So the acupuncture works for the cancer itself. So we have seen a lot of the the articles can report acupuncture improve immunity and also anti-inflammation. And also sometimes acupuncture because acupuncture promote holistic health, it also can help for the cancer treatment also. But acupuncture works more like the nausea, fatigue, and pain during the cancer treatment, the chemotherapy treatment, radiotherapy treatment. And also acupuncture help with the patient's stress, the cancer. People who has cancer, a lot of stress, very high stress.
Oh, yes.
And improve
Yes.
sleep, acupuncture improve the sleep. That is can help people improve the mood and energy. That is one for application for the cancer. And also acupuncture, we discussed the pain management, the weight management, the nerves, and also quit smoking. And acupuncture works for the one week, because I have been teaching acupuncture in China, in United States for 20 years, almost 20 years. Yeah.
Wow.
So what?
You don't look old enough to have done all this.
I'm pretty old now. Sorry. So acupuncture. One we are teaching acupuncture in class. So we teach our student acupuncture works for the stroke, common cold, asthma, vomiting, diarrhea, constipation, urinary issue, mental health issue, dizziness, headaches, joint pain, all type pain, Bell's palsy, sciatica, menstrual issue, tinnitus, and hearing loss.
Oh, yes,
Yeah.
tinnitus seems to be a huge problem that patients are just driven crazy with. So how is it that acupuncture helps tinnitus, which is ringing in the ears?
Yeah, so the hearing issue, we all know hearing issue is the problem. It's a big problem. We don't have a lot of good solution for that issue. Usually for acupuncture treatment, not only for the hearing problem, but also for all type problem, because we learn the mechanism I mentioned, we need a local treatment and with the distal treatment. The local treatment works on the local reflex, and also improve the local healing of the nerve, local healing of the inflammation, local healing of the tissue damage. And the distal treatment, we put the needles, for example, if people who has a tinnitus, and then we put a needle not only in the ear, around the ear, but also we put needle on the arms, we put needle on the legs and the toes, the fingers, the close the finger toes. That is what we call the meridian. So some meridian, they connect to the ear. There are maybe about 6 meridians to connect to the ears. We put a needle on this meridian that also can improve the hearing, the functions. So, but because the tinnitus and hearing issue is very complicated, so when we see the reason, there are many reasons for that one. So acupuncture also need to see what type of the issue, and also we do the different plan for this issue.
And I've certainly seen patients who've undergone all sorts of invasive, expensive infertility treatments who then have acupuncture and get pregnant. Is it primarily through reducing stress, but also rebalancing the hormones as well?
Yes, it's not only for the stress, but also for the hormonal balancing. So when we treat the infertility, the same. We need to put some needle in the lower abdominal areas. We have some point we call the uteral points. We have some points, we call the infertility points. And also we put some needle on the legs, mainly the legs. The legs can have some inside of the meridian. We call 3 yin meridian. There are 3 yin meridians. So this meridian helped connect to the vaginal area, connect to the reproductive the system. That not only for the fertility, but also can help the bladder prop, the bladder, and also can help the bowel movement. Also can work for that. And also acupuncture, because I just mentioned the infertility is not only the target organ problem, it's not only the overall problem, not only the uterus problem, but also the hypothalamus and the pituitary. The imbalance between the top and the bottom imbalance. We call it in Chinese medicine, we call top-bottom imbalance. Top imbalance, top is heart, the bottom is kidney. So heart is our mind, because I have brave heart. Heart means it's not this heart. Brave heart is not, doesn't mean my heart is strong, but my mind, my brain is strong. Right. And also the kidney in Chinese medicine, that is the function of the hormone, of the endocrine system function. So the heart and the kidney connection that represent in the Western medicine, that is the hypothalamus, pituitary, and overall axons. So when we do the treatment, we need to do some top treatment. That means the needles on the scalp area that can help the release the stress. And then we put a needle on the heart meridian, on the kidney meridian, on the spleen meridian, and also local treatment of the abdominal area that can help restore the holistic of the imbalance.
Now, are there any risks associated with acupuncture?
Oh, yes, it's a very good question. A lot of people are curious the risk. Acupuncture is very safe, one done by a trained professional. So the risks are minimal, but we have say there some people might have some mild bruising. When we put some needles, some mild bruising, and also some soreness where the needles go in. So the soreness may be the same day, the evening, because the body has some muscles and response for the needle, and also maybe the second day people feel the soreness, but this is mild. Yeah. And also, it's important to make sure your acupuncturist is licensed or your practitioner is licensed, because some areas, if we put the needle too deep, we have to know how deep the needles goes in. Yeah, some areas, and also we need to use the sterile needles. Yes, so today we always use the disposable, just one-time use needles. We shouldn't use the reuse needle. This is the one thing. And also for some people who has the blood issue, the blood disease, or cardiovascular issue, they are taking the blood thinners. That is something we need to know. So tell your acupuncturist or your doctor that you are taking the blood thinners, or sometimes you're taking some other medication, maybe has some circulation impact in your circulation, and anticoagulant and antiplatelet medication. That is we need to know, because sometimes if we put a needle and withdraw the needle, pull out and take out needle, there's some bleeding. That bleeding is very mild bleeding, just press for maybe 1 minute, and that should be fine. But some people are taking the blood thinner, we need to press for a longer time. There maybe has some bleeding inside.
And how often or how many times is acupuncture needed?
Yeah, it depends. It depends on the person and the condition be treated. Some people feel better after just one session, but some chronic condition usually need a few weeks, 6 weeks, 12 weeks of the regular treatment. Typically, the plan might be once or twice a week. This is typically the plan. And also, for example, for the pain management, if someone come here with the pain about 6 or 8, so with the regular treatment once or twice a week, so we reduce the pain to 2. sometimes 2 or 3. Yeah, from 7, 8 to 2, 3. And then the next treatment we can do less often. So we can do every other week or every 3 weeks. That is just to keep the very low. Yeah, because for the chronic issue, it's hard to say we can 100% fix it. Yeah, for the chronic pain,
right.
if the pain is a very high, 8, 9, that is the, very absolutely, we need to treat it. But if pain is just 1 or 2, maybe we don't need to treat. Just ask people, do some self-stretching, self-maintenance that can help. We don't need acupuncture anymore.
And any final tips or words of advice for our listeners?
Okay, thank you. So final tips. If you are curious about acupuncture, give it a try. Yeah, it's worth to try. It's not painful. It's not hurting. So yeah, it's gentle, natural way to support your health. And also, it can be a great addition to your overall wellness routine. Yeah, but just make sure, once again, just make sure see a licensed acupuncturist or any practitioner. We know today medical doctor with the acupuncture training and also with the like the nurse practitioner, the physician assistant, and also chiropractor, the PT. They all has the plan, the curriculum of the acupuncture treatment and the training. So if you see your practitioner, you have to make sure they have the license, acupuncture licensed, trained. So that is also very important. Yes.
And how can one determine if someone does have a license? Is there like a website or a certain specific credential that we should look for?
So for the acupuncturist, everyone who practice acupuncture as acupuncturist, they must have the certificate, the acupuncture license. Or I think maybe only 3 states in the United States, they do not need acupuncture certificate.
Oh, really?
Yeah, only 3.
What are those 3? What are those 3 states?
I do not remember. So we have totally 50. There are only 3. We can check if you wanted to check, you can go to the website of the NCCAOM. NCCAOM is a national committee of the certification, the committee. So they have the map of the acupuncture license map. I remember 3 states, they do not require the certificate. They can practice acupuncture. Only 3. But Ohio absolutely need a acupuncture certificate from. And this is what I want to say. Maybe it is the final tips. But not only just acupuncturists, for the other practitioner like the medical doctor or chiropractor, I think they need to receive some training program. Yeah, go to training program. They should have some certificate with the acupuncture training or dry needling training. Dry needling is similar. So maybe someone doesn't like someone doesn't like it, but I think, with my experience, I think dry needling is similar. But dry needling focus on the musculoskeletal system. Acupuncture cover more than the musculoskeletal.
Much more comprehensive, yes. Well, we'll include some of this in our show notes. And if our listeners want to get in touch with you or see you as a patient or any social media, are there any contacts that you want our listeners to know about?
Okay, so I'm a full-time faculty and an employee at Cleveland Clinic. If you want to see me, just go to the Cleveland Clinic website, official website, and search the Find Doctor Jing Fan. You can find me, and there are my the information and also the phone number. You can call them to make appointment with me. So, and also. If you have some questions, maybe I think Dr. Thacker has some. Dr. Thacker, do you have any way to can have our audience can reach out to you or to some, because
Yes. Actually, on our speakingofwomenshealth.com, there's a contact us. So if there's any specific questions that people have, you can communicate that way with us, and we will push out Dr. Jing Fan's contact information on our social media. And I encourage our listeners to go on speakingofwomenshealth.com because we do have some content on acupuncture. I think we probably need some more content. And thank you so much, Doctor, for joining us on the Speaking of Women's Health podcast. This was so enlightening. And thanks to our loyal listeners for tuning in for another episode. Please be sure to subscribe for free. You can subscribe on Apple Podcast, Spotify, TuneIn, wherever you listen to podcasts. And if you enjoyed this episode and you want to support the podcast, share it with others.